Thank you so much. I'm so glad that that so many people were able to join us today and learn a little bit more about our Preparing for Research by Engaging Public and Patient Partners Award, or PREPP Award. I wanted to start off, first of all, by acknowledging that myself and Victoria and the Center for Healthcare Innovation are located on the ancestral and current day lands and waters of the Anishinaabe, Cree, Ojibwe, Cree, Dakota, and Dene Suline people, and on the national homeland of the Red River Métis. And in northern Manitoba, we acknowledge the ancestral lands of the Inuit, and gratefully acknowledge that our water is sourced from Shoal Lake 40 First Nations. And in coming together today, we respect the treaties that were made on these lands. We acknowledge the harms and mistakes of the past, and we recognize the ongoing present-day colonial violence that is faced by Indigenous peoples within healthcare, education, justice, child welfare, and government systems. And we really dedicate ourselves to moving forward in partnership in a spirit of reconciliation and collaboration. And really, when we're talking about patient and public engagement, um, uh, it is, in fact, Indigenous research methodologies and Indigenous scholars and communities who are at the forefront and who we should be looking to. And we also believe that patient and public engagement has to be grounded in a social justice and health equity approach. So to start off, as we're talking about the PREPP Award, it's really good to just think about and just be clear that we're all on the same page around patient engagement. And so what we're talking about is engaging people with lived and living experience of health issue, as well as their families and communities, people being actively and meaningfully involved in decision making about the research process. And so a lot of times an easier way to think about it, or to begin thinking about it, is research with or by people with lived and living experience instead of for or about them. And it's always good to just differentiate between participants and partners. So participants are people who are recruited as part of a study, and you're collecting data on them. So you're running focus groups or surveys. So a lot of times qualitative research where the participants don't actually have any decision-making power about the research process. So what topic we should be looking at, how to frame the research question, how to design the methods and methodology, all of that. Whereas when we're talking about patient and public engagement and partners, we're really talking about people with lived and living experience, again, of a health issue, or their families, their informal caregivers, their communities, who are actively involved in decision making about research. And so they oftentimes will see people with lived experience as co-researchers, or we have patient and public advisory groups. We have people at the highest levels of governance of research, so steering committees, data safety monitoring committees, all of that, operations committees. And so when the Preparing for Research by Engaging Patient and Public Engagement, our PREPP Award, first began, a little bit of the history is we had originally in 2015 done a survey of Manitoban researchers, health researchers, and we really started asking them at what level of engagement are they working at that moment of time? What were some of the barriers and challenges that they were having in doing engagement in a meaningful way in health research? And so what we started to learn was some of the big barriers, of course, were training and resources, but also having funding to engage people with lived and living experience at the very, very early stages of research. So oftentimes, people, when health researchers didn't have enough funding to compensate folks and to engage them at the priority setting stage and at the larger grant development stage. And so by the time they got perhaps the Canadian Institutes for Health Research or a bigger, larger grant to fund the research study, a lot of the big decisions about the direction of the research had already been decided, and it was kind of later in the stage to be engaging folks. So we really wanted to answer that by having a small pot of funding to help compensate and help to engage in the early stages. And so it's addressing that key gap engaging early in the research process, which allows for more shared decision-making power and flexibility in the way you design the research. People with lived and living experience need to be involved prior to receiving larger grants. So we really want to have health research focused on priorities that are identified by people with lived and living experience. And we need funding and resources to support the engagement of people with lived experience at the early stages of research grant development. So that's how the PREPP Award came about. And so this was a quote from one of the participants. The type of support that would be most beneficial to me was funding to develop community partnerships, as once partnerships are developed, lots of research can be produced, but takes time to set up and connect with groups and communities. And so really PREPP is about engagement at the early stages, because we know that there's plenty of evidence that shows partners can help to identify research priorities that matter most to patients and caregivers and communities. They can help shape and clarify a research question so that it's actually responsive to the needs of folks. It helps to ensure that research methods and designs that are being proposed for the study are appropriate, acceptable, and sensitive to the real world context of patients and caregivers and communities. And then also to help ensure that the outcomes that we're looking at in our research projects have meaning to those who are living with a health issue. And we know that there was some expectations at that time, and still to this day, from funders and publishers. Health researchers who were applying for funding awards and submitting manuscripts were expected to demonstrate how they had involved patients in preparing the grant applications. We knew that they were being asked to outline what changes were made to the application as a result of engagement, to explain how they are focusing on patient-identified priorities, and really outline in detail how they want to involve patients in the design, conduct, interpretation, and dissemination of the research. So we knew researchers were being asked this, but at the time they didn't have the resources or funding to be able to engage at those early stages prior to submitting a grant application. And so the objectives of creating was really to make sure that Manitoba health researchers are actively and meaningfully involved patients at the very, very early stages of research. So when they are just even thinking about what area should I be looking at, and how should I ask this question? What's questions really important to folks? Ensuring that patient and public engagement in health research in Manitoba is being done in a really meaningful and authentic way by the Centre for Healthcare, by offering award winners are offered kind of in-kind training and advice and mentorship along with the funding. To strengthen patient-oriented research grant applications that are coming from Manitoba by facilitating research that focuses on patient-identified priorities and is actively engaging patients as partners. To bolster Manitoba health researchers' ability to have their research findings published in academic journals and share with a broad audience their engagement. To support opportunities for Manitobans from across the province to actively be involved in informing health research priorities, outcomes, and design and methodologies. And then also to contribute to the science and best practice of patient engagement by looking at and evaluating some of the award winners' patient engagement activities. So there's lots of great objectives as we moved along. And so when we started back in 2017, we launched in the summer of 2017 with 10 award winners. It was modeled after a really small bursary fund from the National Institutes of Health Research in the UK, I think specifically in the Yorkshire area. And it began with, we did 20 awards per year of $2,000 each, but we started getting feedback by both health researchers and community partners that the $2,000 didn't necessarily cover for engagement of rural and remote communities and some of the costs that incur when doing that. And so we adjusted it to $4,000. It's now 5 awards per year at $4,000. And to date, we've had over 50 award winners. And part of our review process, and a really, really important part of our review process, is that we have collaborative partnership members who are part of the review committee. So these are community members who work with the Center for Healthcare Innovation. We meet on a bi-monthly basis. And so members come forward to sit on the review committee and review applications. And there's an equal amount of community partners, health researchers, and patient engagement, and the patient engagement team here who are reviewing the applications. And so each application has a patient reviewer and a researcher, as well as a patient engagement person. And we help with the review process by offering an orientation for patient caregiver partners and health researcher reviewers, where we come together and kind of walk through. We have a really accessible rubric that helps our reviewers score, and it's really informed by CHI's Valuing All Voices framework. We typically give a month to review applications, and they're divided among reviewers. So the burden is not that one reviewer has to review 30 applications, but rather each application is reviewed by a patient partner, a researcher, and a patient engagement person. And then there's a variety of options for people to submit their scores online, by paper, even by phone or in person. And then any close scores, we bring the committee together to talk as well. And so here, so the Preparing for Research by Engaging Patient and Public Partners Award started up in 2017. And we've gone every year so far with over 50 award winners. We also introduced the Dr. Wadaman Srisa Kuldi Memorial PrEP Award, and this is in honor of one of our colleagues who passed away in 2021, who is a huge supporter of the award, was a reviewer, and was a big proponent of patient and public engagement, especially in data science. And so this particular award is for those who want to engage people with lived experience and community in technology, engineering, or data science. And we know this is an area where there's still a lot of people just starting to wade into patient and public engagement. And this fund is really to help support those early stage projects where people want to engage, and they might just need some extra support from folks, not only funding for community partners, but also support with developing an engagement strategy and so on. And so who's eligible for the award? It's open to all Manitoba researchers, students, and community organizations. It's open for folks who are planning a health research project or program that is aiming to involve patients or members of the public in decision-making about the research design at the very early stages, that the research project hasn't been funded yet. So it's still in the very early stages of development, in the design and grant development phase. And we always encourage previous applicants to reapply as well. And some of the assessment criteria that we look at when we are reviewing these applications, we first of all look at kind of the overall quality, the appropriateness, and the proposed level of engagement that you want to engage folks in. The evidence, so demonstrating that there's a commitment to two-way relationships, trauma-informed approaches and methods for equity, diversity, and inclusion, that there's potential impact for the engagement on research and those involved in the broader context. We look at the feasibility of what's being proposed as well, and then that it's in alignment with the principles of patient-oriented research and local health authority, as well as local health priorities. So for the overall quality of the proposal, we look at the clarity. So making sure that the application is easy to read, that the engagement methods are clearly laid out, really recognizing that we have community reviewers, we have a diversity of different perspectives and reviewers who are looking through these, and that it's written in a way that's accessible. and understandable. That all the questions that are being asked are being answered. We look at the scope, so making sure that it's focused on early engagement at the priority setting, the refining the research question at the co-developing design and grant development phases. Looking at originality, so demonstrated attempts to consider some of the innovative participatory or engagement methods that meet people where they're at as well. The appropriateness, we're looking at the fact that planned engagement will be informed by partners, that some of the engagement or participatory methods address the needs and the values and the expectations of partners, that patient partners have significant decision-making power in the research, design, and grant development. So also demonstrating that there's flexibility in these decisions should patient partners say, hey, that that priority or that research question doesn't resonate with us, we want to go in a different direction, demonstrating that there's a fair amount of flexibility and adaptability there. So looking at the level of engagement as being kind of collaboration or even community directed is always going to get you some extra points if you're applying. So that it goes beyond just asking for feedback, which is the consultation level of engagement, so that there is some shared decision making going on in the co-design of the project. As far as here's a few of the resources that can help with those types of questions. First of all, we have the Readiness to Engage workbook, and that has some critical reflexive practices for individual research team members as well as teams themselves to really examine perceptions and values and needs and priorities, and really assess the level of decision-making power and flexibility you have and which decisions are actually open for shared decision-making. As far as the level of engagement, people may be able to involve partners at different levels through different stages of the research process. For the application, there is a focus on the level of decision-making power in the planning stage of the research. And we're looking at, again, priority setting, research questions, design and grant development. And so there's a great little blog post that talks about the different levels of engagement, so you can really get a better understanding of what's a collaboration level versus a consult level. And then for methods of engagement, there is a great little workbook or a guide that goes through the different variety of participatory methods for different stages and phases of the research process and the different levels of engagement. And so we process mapped the health research stage. Sorry there, I was gonna cough. So we process mapped all the phases and stages of the research process, and from there looked at every level of engagement and different types of participatory approaches. So this workbook is really helpful if you're starting to think about, oh, what potential participatory approach would I like to use when we're doing a priority setting exercise, or when we are trying to refine a research question, how can we perhaps engage folks and meet them where they're at? For the commitment to so another area or another criteria we're looking at is the commitment to relationships. So really describing how the relationship is two-way and it's reciprocal, and how you're going to build it and maintain it. How are you proposing to develop trust and transparency around the research design and grant process? How perhaps the research team members and the patient partners maybe engage together and participate in shared learning opportunities and discuss the bigger picture of how you envision engagement will impact everyone who's involved. And one of our articles, the Valuing All Voices framework, is super helpful when you're starting to think about relationship building, and that and how you propose to build trust with folks and how you propose to come together. And this was informed by communities in Manitoba as well. As far as trauma-informed approaches, really thinking about describing some of the methods that you're going to be using to co-create safety or brave spaces in engagement. So are you going to have discussions around safe spaces, or perhaps build guiding principles to working together? We have a 4-part blog series that goes through trauma-informed engagement and give some suggestions on how you might do this. As for equity, diversity, and inclusion, really discussing how power imbalances will be acknowledged and addressed in your engagement process, describing some of the methods that you might use to ensure that diverse perspectives are not only included, but also that people are able to contribute in a meaningful way. And really explicitly talking about voices that may traditionally not be heard in health research and how you're going to engage those voices. And the below blog kind of goes through things that you need to think about when you are going to recruit, and the different voices and perspectives that you should include in your engagement. And then looking at the impact of engagement, uh, looking at that you have a plan for how partners will be involved in the decision-making process, that you're going to describe some of the potential benefits and harms and plans to provide supports for patient partners who are being engaged, what type of approaches should provide opportunities for what you might think about for co-learning and capacity building and co-benefit, and then consider the bigger picture or impact of the engagement on the research team, the organization, and field of research. For feasibility, this is when we start getting into the nitty-gritty a little bit. And it's interesting, we say be explicit and be flexible. And what that really just means is we understand with engagement, you might propose a certain number of people being involved or a certain participatory approach. But as you move forward, perhaps you talk to community leaders and they suggest a different type of participatory approach or a different number of people. We understand that, and it's great to preface any of your potential plans by saying, yes, we will also make sure that this is responsive to the needs of the communities we do want to engage. But you can still put forward the number of people you're hoping to involve, the duration or the frequency of the meetings that you're thinking about, some of the roles and responsibilities community members might be able to play, how barriers to involvement will be addressed by your team, and then some of the contingencies for changes to timelines and budget needs as well. And some of the resources that you can use include, we have a lovely budget builder. It's an Excel-based budgeting calculator with a printable 1-page budget summary. And so it provides guidance and suggestions for important considerations. We involved community members in the development of this tool, and it really goes through some of the comprehensive things that you need to think about as far as addressing barriers to involvement and ensuring supports are accounted for. And so you can use this for your own proposed budget as well. And then the alignment with patient-oriented research principles. For those who perhaps haven't heard this term or are new to this term, really what it is it's a continuum of research that engages patients as partners. It focuses on patient-identified priorities. It works to improve patient outcomes. It's conducted by multidisciplinary teams in partnership with relevant stakeholders, and it aims to apply knowledge generated to improve healthcare systems and practices. And when we talk about addressing local priorities, again, this is where you clearly describe how the research topic will be chosen and by whom. And you can link it back to some of the local priorities, whether it's patient and public partners or communities or affected populations who have said this is a priority area. to you, whether it's local organizations who Cancer Care, Addictions Foundation Manitoba, Nine Circles, all of these different groups, whether they've said that this is an important area, but also looking at Manitoba's health system. So in shared health, has it been a priority identified by the Clinical Preventative Services Plan as well? So linking it back to local priorities. Preparing your application. Now we get into the good stuff, the exciting stuff. So preparing for your application, again, oh my goodness. Again, try to write in lay language. And so aim for about grade 6 reading level. And there's lots of tools that can help you with that. As patient and public partners will be part of the review team. So try to avoid any of the medical research jargon and acronyms as well, and make sure you address all sections of the application form. And the application form is laid out in 7 different components, which we'll go through. So your lay summary, we do suggest 150 word limit, but really ensuring that your summary addresses the following aspects. So describe how the PrEP Award will aid in achieving the early stage engagement goals of your project, how you will engage people with lived and living experience, and specify how their involvement will influence decisions related to your project. And then what you hope to achieve through engaging individuals with lived and living experience. For the project information, really describing the selection of the research topic and questions and methods and outcomes, and our future grant development. So explain how these will be determined, including the level of decision-making power, the level of engagement that's going to be granted to people with lived and living experience. And for goals and outcomes, really specifying the objectives. The purpose, why are you engaging patients and the public in decision-making about the proposed research? Project information, describing engagement and research decisions, so really detailing the specific research decisions in which patients and public partners will be involved. So identifying the research topic, the questions, the priorities, or the outcomes. Are they going to help develop recruitment methods or interpret data or review study materials for accessible and appropriate language? For the engagement activity section, really providing a detailed description of what you're planning to do, what planned engagement activities, so related to priority setting, research design, and grant development. So thinking about the goals and objectives. So what is the purpose of each activity? Why did you choose this participatory approach? And then the frequency, the duration, and the number of patient and public partners involved. For engagement activities, really thinking about describing the supports that you're going to put in place, the facilitation methods that you're going to use to enhance engagement, explain some of the processes that you're going to use to ensure that patient and public partners' perspectives, concerns, and values are being meaningfully represented in the decision making. As far as patient and public partners, really think about identifying the populations the research team intends to engage, describing the recruitment process and how you're going to ensure equity, diversity, and inclusion will be prioritized. Discuss how some of those barriers, such as accessibility, travel, and childcare needs, will be identified and mitigated. And then the funding award budget itself is really a summary of costs. So describing any additional support, funding, or in-kind that may facilitate engagement beyond the PrEP award. And the emphasis for the budget is very much on compensation of patient and public partners and addressing any of the barriers that they might face in being involved and engaged in your research. Some of the costs that should not be included in the budget would be data collection or honorarium for participants in research studies. So the grant is not for qualitative research, it's not for collecting data on participants. Borrowing funds to other research projects, publication related costs, or researcher conference fees, those types of things is not what the funding award was intended for. It's really to help facilitate the engagement of folks at the early stages of your research process. Letters of support are totally optional. They're not required. They have minimal impact on the funding decisions. But you can have them included, and they can describe pre-existing relationships or financial in-kind supports. Some of the relevant PE resources that are available, and I think you will get this lovely presentation afterwards. So the application form, some of our resources and tools that will help you in filling out your application. And there's also some great blog posts that can help you think through each of those steps. Some of the articles that may be helpful as well is our trauma-informed intersectional analysis and critical reflexive questions for teams, and also the valuing all voices framework. That really helps when you're talking about the primacy of relationships over research and how to build that trust. Some of the award requirements and conditions. So once you've won the award, which you're all going to do, once you've won the award, one of the first things is you'll have a consultation with our patient and public engagement team here at the Center for Healthcare Innovation. You'll also attend a lovely PREPP award orientation where you'll get to meet other award winners and really network, and it's usually a lovely affair. And then we'll ask you at the end of the 18 months in which you're holding the funding, we'll ask you to complete a final report within 2 months of that time, so following the award term. We're also going to ask you to present at this lovely webinar series. We really want to hear from you and your patient partners, and really about how the engagement went, and share your successes. And then again, there's and then also acknowledging the funding and in-kind support and any related posters or presentations and publications. And we love to hear when people publish an article on their engagement, or they go and present on their engagement, or perhaps a policy is implemented due to their engagement. Some of our previous award winners, we have over 50, but this is just a little snippet. We've had such a broad array of different projects over the years. And these are links actually to their presentations. So we've had engagement in a systematic review on ER wait times, and that was Dr. Maya Jerriman. Community engagement about sugar sweetened beverage tax, which was Dr. Natalie Riddiger. Engagement around outcomes of thoracic surgery, and that was Dr. Satish Srinathn. And then family engagement workshops about chronic pain in youth. That was Doctors Christy Whittemire and Kirsten Gerhold. We've also had amazing engagement in scoping review design by Dr. Anna Hudick, and engagement in clinical trials design with Dr. Dylan McKay. So this gives you a really neat array. We also have a blog series that's based off of one of the engagements around type 2 diabetes with youth and caregivers. And the award winner was Leanne Dunn. And it gives each perspective of the caregiver perspective, the youth perspective, and the researcher perspective of winning the award and the work they did. Oh, wow. We are at the end, so I should open it up to questions.
Thank you, Carolyn. So I'll give folks a minute to submit any questions they might have. You are also welcome to ask them anonymously if that makes you more comfortable. The one quick question we did have is just whether the slides will be available. So those will be available in addition to the recording. You will receive the links to where to find those in a follow-up email from this webinar. Or you can find them in the Q&A section of the question I've answered so far. I will also give a quick bit to the PREPP Awards. So we launch February 3rd. It will be available on our website and announced through our newsletter. I unfortunately cannot post direct links, I don't think, without a chat feature. So apologies for that. But we also have 3 sponsors this year for our award. So we have the Children's Health Institute of Research coming back, or CRIM, supporting a project in child health. We have Cancer Care Manitoba coming back for a 2nd year now, and they will be sponsoring a project related to cancer and blood-related disorders. And we also have joining us this year the Manitoba Center for Health Policy, and so they will be supporting projects in projects that use administrative health data that is housed at the center itself. See one question here. When is the award project deadline and then disbursement? Can someone apply that already had initial meetings with potential project partners?
Maybe, did you want to do the deadline and disbursement piece, and then I can do the the second question?
Good. So the award application deadline is March 31st, basically end of day, 11:59 p.m. And then we typically announce the winners following our extensive review process, usually around June, early June. And then we have our big celebratory orientation sometime in July, pending people's availability. And then, yeah, Carolyn, can someone apply that already had initial meetings with potential project partners?
I do think that's still, I think you can still apply. You haven't gotten funding to go forward with the research. I think if you've just had some initial meetings, but you still are at that phase of priority setting and developing the research question and thinking about developing maybe a grant application and going through the design, I think you can definitely still apply. It's very much open.
And we also encourage folks who did not end up getting it a previous year to reapply and incorporate any feedback they've gotten since then. That's all we've got so far. Oh, here we go.
Oh.
In addition to the 3 organizations just listed, where else do the funds come from? I would love to start something like this outside of your province.
That's a good question. So the funds do come from the Center for Healthcare Innovation. And then we over the years have had some sponsors as well. I think one of our first sponsors was a Manitoba primary healthcare primary integrated healthcare network, one of the picking networks, the SPORE units at the beginning. But since then we've had some other lovely sponsors, but it is funded through the Center for Healthcare Innovation. And definitely, if you ever want to, you can always reach out to us and we can chat further if you're thinking about starting an award like that. And we can always help you with giving some advice on like things that we've learned, lessons learned, and things that might be helpful as you're working through this. That's exciting that you're thinking about doing something similar.
And I'll put a response to your question with our email. And you can also find this email in our follow-up to the webinar. It will say if you have questions, you can reach out to a specific email address. You got a big thank you, Carolyn. So I saw online that there is an opportunity to get advice about the design of the consultation participatory approach. Is this correct?
Yes, you can. Yeah, it's always a tricky one. You can definitely have a free consultation. Typically, what happens is whoever consults with you from our team will not be involved in the review process. We'll just make sure that so there's no bias or things, but you can get some help in thinking through your early stage engagement strategy. That's for everyone, even those who are not applying to PREPP Award. We are here to do consultations with teams who are thinking about doing engagement.
I'll actually post in the answer to that our intake form
Yes.
in just 1 second, but I'll read the other question coming in now and then I'll do that. Is this award exclusively for research in the early process, or can this be used to strengthen connections that have already been created, but will be used in a new grant?
I think so if you've developed a good community partnership or relationship, but now you're at the stage where you're thinking about developing, or you're thinking about applying for a larger grant and you want to get people together to do priority setting exercise and to start helping develop what that grant is going to look like. Absolutely, that's what it's really for, bringing folks together to help inform those types of decisions and be actively involved at the early stages of the research process. So in that way, I would say yes.
We've gone through all the questions submitted. Maybe I'll give it another minute or so if anyone is typing. Or otherwise you'll get a bit of your lunch hour back. To everybody. And of course, you're welcome to reach out to us as well post-webinar if there are any questions you think of later. All right, seeing none coming in. So I think everyone's ready to apply. But I'll just take a moment then to close us out. So I just want to thank everyone for coming today and joining us for this session and asking all these wonderful questions. And of course, thank you to Carolyn for all her expertise on the history of the award and establishment and processes. So everyone will receive a follow-up email with further information on how to access the slides and the recording. You don't have to worry about us saving those from the chat here. And we also welcome your feedback for this session. So it will come as a prompt to a short survey when you close this webinar, and should take less than 2 minutes to complete. So thank you all again for joining us, and we wish you a good rest of your day.
Thanks so much.
The deadline, there's a quick question there that popped in. I'm just gonna answer it if they're still here. To use the award funding by is usually 18 months. There we go.